Welcome to the Break It Down podcast, organized by Nigeria Health Watch. I am your host, Vivianne Ihekweazu. The Break It Down podcast is a platform that stimulates engagement and conversations around the various health issues that Nigeria Health Watch advocates for. By informing listeners, we want them to be better engaged and better equipped to ask the right questions to our decision makers, holding them accountable for better healthcare. Our podcast aims to break down complex health topics and communicate them in a way that is accessible to a wide audience, including policymakers, healthcare professionals, and the general public. So let's get right into it. This episode this week will focus on the upcoming Africa Health Agenda International Conference, AHAIC, organized by Amref Health Africa. Scheduled to take place 2nd to 5th of March in Kigali, Rwanda. This year's conference marks another gathering to drive Africa's healthcare leadership and thought leadership in the global health space, under the theme Connected for Change, addressing socio-ecological dynamics of health. So, as we mentioned, this is another convening driving African healthcare leadership, and we hope to delve into the intersection between health, sustainable funding, local capacities, and environmental factors shaping Africa's future healthcare. Today, we are happy to be joined by Dr. Githinji Gitahi. He is a passionate advocate for universal healthcare coverage and serves as the Global Chief Executive Officer of Amref. Welcome, Dr. Githinji. Good to see you. Can you introduce yourself to our listeners?
Yes. My name is Dr. Githinji Gitahi, as Vivianne has said. I'm the Group Chief Executive Officer of Amref Health Africa. I'm a medical doctor by training, and I have now been with Amref for about 10 years. I'm a passionate advocate for UHC and public health, and here I am. And thanks for having me, Vivianne.
It's such a pleasure to have you, and really looking forward to all the discussions that will be taking place at this year's AHAIC. Can you share with us, as we approach this next convening, what has been the inspiration behind the convening? I would like to hear a bit more about this year's theme as well.
Yeah, this conference, which was originally Amref Health Africa International Conference, we rebranded it to Africa Health Agenda International Conference in 2017. And the reason for that was to give it a continental platform and to move it away from looking at ourselves inwards as Amref, but giving Africa a platform to host its own convening of minds, policymakers, communities on Africa's health agenda. And the reason for that was that I strongly believed that the Africa Health Agenda is actually different from the global health agenda. Though they're intertwined, they're different, and we'll explain why. And because of that, we have held this conference every 2 years to give Africans the platform to kind of create the narrative for their own agenda towards lasting health change and universal health coverage in the continent of Africa. Now, we know we have navigated multiple themes since we started the conference in 2017, and before that as Amref Health Africa International Conference in 2015 and 2013. But we have navigated multiple themes. We've navigated the themes of primary health care. We've navigated the themes of universal health coverage. We've navigated multiple other themes. And this particular time, Vivianne, we have decided to focus on socio and ecological dynamics of health. Why? Because we find ourselves, the continent finds itself at a crossroad, especially because we still have a long way to go to optimize the investments in our healthcare systems. But at the same time, we are having new existential threats, and those threats are going to dismantle the progress that we've made on the health systems. And those threats include the social threats, for example, poverty, debt crisis, education, teenage pregnancy, all those areas that actually impact the health outcomes of communities. But at the same time, we have unprecedented global warming. And this global warming is going to disrupt the health systems from, multiple dimensions. One, of course, being the destruction of the health infrastructure itself through extreme weather events, but also a rising new burden of emerging and re-emerging diseases through outbreaks that have to do with environmental destruction, global warming, and also impact on people's lives through drought, malnutrition, and such other things. So we think that is the right time for Africa then to say, what is the Africa health agenda at this particular time because of these existential threats?
Thank you for that. I mean, that was going to be one of the things I was asking, because the theme you touch on, the socio-ecological dynamics of health, we understand that health, or the things that impact health, are not just healthcare facilities. There are many socio-economic factors. You mentioned climate change, you mentioned the environment, those social determinants of health we often don't look at, because, we know that health is very multi-sectoral. And over the years, we've seen how these changing dynamics have influenced the healthcare access and outcomes of many on the African continent. And yes, you're very right. Our particular health issues are very different from the other continents. So it's very important that we are convening this event again this year to really focus on these health issues, as you mentioned, that really impact us on the African continent. And one of the central themes we're going to see from your conference this year is, you mentioned connected for change. Can you elaborate a bit more on what role you see that collaboration across sector, how that plays into the health agenda in Africa?
This theme of connected for change came upon and is going to be a leading theme in the conference, because we feel that with this social and ecological impact on health, it is then clear that health is too important to be left to the health ministry alone. And therefore, we need to be connected, number one, across sectors, number two, across geographies. So we know, for example, that we have learned during COVID-19, Mpox outbreak, and now Marburg, that inter-country or inter-geographical collaboration, continentally, regionally, is critical to the management of diseases, to ensure that there is a minimal risk to every citizen of the continent. So on one side, where we are talking about collaborating across sectors because of these new threats, like the climate change issue, environmental degradation, is going to mean that there is a major threat for human health, animal health, and planet health as well. What that means is that health has to collaborate and connect with other sectors. We have to connect with the environment sector. We have to connect with agriculture. We have to connect with livestock. We have to connect with, what I would call meteorology. And we have to connect with all these other sectors to ensure that we minimize the threats that exist to our people. So that is first connecting together for change. But at the same time, we have to connect between countries. And the reason for connecting between countries is not only for disease control, but also for collaboration in areas like response, regulation of health products and technologies, ensuring that we get together to have a common manufacturing plan for Africa so that Africa can actually assure itself of health security, ensuring that we can pool our resources, ensuring that we can actually achieve the Africa Continental Free Trade Area, not only for trade, but for health and peace. This connectedness across geographies and across sectors is what we want to be the lead theme at Africa Health Agenda International Conference 2025.
Yes, absolutely. And very much that connectedness, we've seen it, for example, during the COVID-19 outbreak and other infectious diseases we're seeing, that, they do not respect borders. And that collaboration and connectedness, not just the African continent, across the countries, but globally. So we are all interconnected, and that's ultimately, it's important why we have these convenings that bring all these disparate stakeholders together. Thank you for that, Dr. Githinji. I'd like to just remind our listeners that this special edition we're having today with Dr. Githinji is in the lead up to the Africa Health Agenda International Conference taking place in Kigali, Rwanda, 2nd to 5th of March. And this year, the conference theme is Connected for Change, addressing socio-ecological dynamics of health. Just another question, Dr. Githinji. Amref health has really been at the forefront of promoting African-led health solutions. How does AHAIC aim to amplify this thought leadership in global health?
We as an organization have become kind of a convening force in global health for the continent of Africa, obviously because we have the authentic voice, the trust of the communities and the government, because we are Africa-based, Africa-born and Africa-bred. And because of that, we have been given this trust by communities. And for us to be worthy of that trust, it is actually to enable neutral conversations at the conference. So within this conference, we want the communities and the government to take lead in the conversations, to lead in the agenda setting. And as we talked about connected for change earlier, one of the dimensions that I would like to bring in there is the connectedness between politics, the social sector, and the economic sector. Because again, health is not just a social sector issue. It's also an economic sector issue. It's a political sector issue. Because healthy people, exercise their rights, their political rights, and healthy people do not or are not able to do so. So we are going to bring all these sectors together, African politics, African social sector, and African economics, to debate the issues of the continent and to take ownership and leadership of these issues. As you've seen, Vivian, the geopolitics of the world is changing. And we are seeing even African people themselves realizing that change is inevitable. We have seen African people start to actually develop a negative attitude towards aid because they feel like their own countries and continent need to take ownership of the needs and the social needs of their own people and not to depend on the charity and goodness of others. Whereas it doesn't mean that we don't need others. Whereas, to reflect on what Kagame said a few years ago, he said, because we do it ourselves does not mean we do it alone. Meaning that we need to do it ourselves, but include others as well, because global partnerships are important. But that means that within this conference, we are focusing a lot on how do we also do it ourselves? How do we take hold of health financing and ensure that the global development aid, the development assistance for health, is actually part of our own financing agenda, not otherwise? How do we ensure that the health systems we set in Africa are actually led by the African agenda, where communities are the center, because communities are central to Africa's development, where actually Africa's governments are leading the agenda, even when it comes to the Lusaka agenda, for example, when we are talking about ensuring that foreign assistance is integral to the country's health systems and primary healthcare approach, that is led by the government themselves. So we want to make sure we drive this central agenda of Africa being in the lead of their own agenda and ensuring that when they're doing it themselves, they're also doing it with others, but the leadership is coming from inside.
Absolutely, because we know that health is very much a political issue. And how you mentioned that geopolitics is now showing us the vulnerabilities we have on the African continent. And very much so, the recent funding cuts from from many governments has really shown how vulnerable we are as a continent to external funding. And this is a key time for us to now take ownership of our own healthcare. We also think that as decision makers and as NGOs and CSOs, we understand the issues. But the reality is the average Nigerian, the average Kenyan, Rwandese does not always understand these health issues. And I think for many, this is a wake-up call as they're finally seeing how vulnerable we are on external funding. And it's really good to see many other people engage beyond us in the health sector about how health financing on the continent has to be not just led by external partners, but we as a continent have to take ownership, and our political leadership. I think this is a wake-up call for them too. So this is a very key time to be having this AHAIC conference. Let me turn to another issue that is also an existential threat to the health of our continent's population. Climate change and environmental degradation are very much recognized as very, very key health challenges. So how can African health systems build better resilience for these emerging challenges while addressing the existing health burdens we have, such as infectious disease? I know that Amref has been very much in the forefront of leading these discussions.
It is important that we recognize that the African health systems, as they are suboptimally funded. And that is, that's a fact based on reports. If you look at the WHO UHC report, you will see that Africa has the lowest penetration for universal health coverage at about 46%. Now, this is because of many factors, and those factors are reflected in a report, in the commission report we did, which we call the AHAIC UHC Commission Report in 2019, looking at what are the vulnerabilities and the strengths of the African health system. And one of them, of course, is financing. And that financing issue, because the African health system is the least funded, means that you cannot invest adequately in, for example, what we call the international health regulation competencies, ensuring you have, the adequate health workforce, laboratory system to detect disease. So this is number one, that we have an under-invested health system. And it has to do with Africa's population and fiscal space. So it's not purely a political issue. It's also that we have at least the smallest economy in the world with a large population, and that complicates tax collection and how much money you have to address social issues. So that's the foundation. The next thing is to say, these health systems that are already suboptimal, how do they prepare themselves for these changes, these socio-ecological changes? They have to prepare themselves by first investing in early warning systems, so that when there is a threat, you can recognize the threat early enough and address it before it becomes a reality. Because when it becomes a reality, then we may not be well funded to respond to it. So early warning systems are critical. Secondly, it is integration of communities, so that the communities are part of the first responders. We cannot afford a purely biomedical model, Vivianne, because we don't have the money to afford a biomedical model. So community response and community resilience has to be one and the first and the most important health system building block. In fact, I have in the past been recorded to say the WHO needs to review the health system building blocks to include communities as the most important building block of the health system, and to stop looking at only supply side building blocks and look at this demand side building block as the most important. So that has to be a central part of our resilient health systems. The next thing is to ensure that we have control over our health commodities and technologies. And this is why the Africa manufacturing agenda has been so critical since COVID, because you cannot have a resilient health system when your health products and technologies are in the hands of others, meaning that when you have an outbreak, you have to rely on others to supply and to respond to it. So the manufacturing agenda is critical to creating resilient health systems. And finally, is to ensure that leadership is central to resilience. And that leadership has to be a leadership that is people-centered, that recognizes that the people and the communities in Africa live differently from other communities. That when you look at the informal sector in Africa that occupies 80%, that informal sector works from dawn to dusk to ensure they have a livelihood. Therefore, if you have health facilities that do not open dawn to dusk, then you're not responding to the people-centeredness that people want. During COVID, Vivianne, we saw that even people in Africa who wanted to get vaccinated for COVID, because they're working dawn to dusk 7 days a week to earn a living in the informal settlements, they could not access vaccination because the facilities near them were only open from 10 a.m. to 5 p.m. and were not open on Saturday and Sunday. And therefore, unlike those who are employed, who have a schedule of work, 80% of Africans could not access vaccination. And this was called hesitancy, because basically they were leaving their house at 5 a.m. and coming back past 6 p.m. and the facilities were closed. The pharmacies were not operational because the pharmacies were not allowed to do injectable vaccination. These are the things that we must discuss from an African perspective and ensure that the resilience of our health systems must be dependent and must be designed from the people's behaviors of our own African people. This is what we mean by response to social and ecological determinants that have to be based on people's lifestyles in the continent.
Yes, absolutely. I think, I'm sure you had the same experience in Kenya as we did in Nigeria, whereby when we, during the COVID outbreak, we were responding and copying and pasting what was done in geographies in the global north. And as you very much mentioned, people live hand to foot. And so that whole closing down, shutting down, we have an environment where many people are working in the formal sector. So So having those safety nets that many other countries had, we did not have them in Africa. So I think this is an opportune time for us to come together to kind of think through our own Africa-led solutions. And you're very right. The communities are very much at the center of healthcare. And we know that if we do not have strengthened health system at the community level, as we have in Nigeria and across other African countries, we will always remain vulnerable to this external threat. So thank you very much for that. We all have shared issues and shared problems that we all need to come together as a continent to solve ourselves. Of course, with political leadership, which is why we often call on our political leaders to engage in such conferences. So really looking forward to AHAIC, and I think you've alluded to this a lot already, but generally, what are your thoughts for the next steps for African countries in terms of integrating some of these socio-ecological considerations into our national health strategies that you've discussed?
I think in my conversation with ministers of health and and global health leaders recently, we had a convening at the World Health Summit, and we had ministers of health from Africa. We had global health initiative leaders. We had leaders like Tedros and others. And the overriding message was that we need to redesign our health systems. I think that's the future, Vivian. That the health systems we have currently need courage, leadership to redesign them. And if we don't redesign them, they're going to collapse and they're not going to serve the African people. A few examples. One, we have new threats. We've talked about global warming. That's a major threat to our health system because the disease pattern is going to change completely as we know it. And if we don't redesign the health system to be responsive to these changing disease patterns, then we are not going to be able to respond to the demands of the people. The second thing is that we've just come out of the Global Forum for NCDs in Kigali, which is just a few weeks ahead of AHAIC. And we know that by the year 2063, which is the last year of the Africa We Want strategy, it is more than 80% of all our mortality, all our deaths, will be from non-communicable diseases. Now, we know that our health systems right now, as actually structured, are not structured to respond to a rising non-communicable disease burden. They are actually structured largely for communicable diseases. And yet we know the communicable diseases financing has been largely supported by our global partners. We know that it's been significant. Almost 20% of our, actually more than 20% of our communicable diseases are funded through partners. But that is now changing geopolitically. We know that the new burden is going to be non-communicable diseases. We know that there are new existential threats like climate change. So we cannot incrementally change our health systems. We have to overhaul the design, and we have to also to realize that with rising debt distress that we are seeing, with rising populations, with economies that are not rising because of global disruption, we will not afford to support a biomedical model where we wait for people to get renal disease and then take them for dialysis. We won't afford it. So we have to prevent the renal disease. We have to prevent the cardiovascular disease. We have to prevent the cancer. We have to say that, for example, cervical cancer is completely preventable and eliminatable in the continent. We have to ask ourselves as a continent, how do we eliminate cervical cancer so we don't have to treat it in future? That means we have to employ technology like HPV vaccination for every girl by 15. But that means that we have to move away from biomedical models of our health system where we just focus on treating cervical cancer. This redesign is needed, and this redesign is urgent. So this is really what we need to focus on, starting at AHAIC and moving forward. And you will see that for us, we are thinking about redesigning the health system to move in more and more upstream to prevention, to lifestyle, to control of trans fats, to control of sugars, and to control all these things so that we avoid the eventuality of treating disease. Because I can tell you, we will not afford to treat disease, but we can afford to prevent it.
Thank you so much for that, Dr. Githinji. We're slowly wrapping up this this podcast today. And just to remind our guests again, this is in the lead up to the AHAIC conference taking place in Kigali, Rwanda, 2nd to 5th of March. And we were joined today by Dr. Githinji Gitahi, who's the Global Chief Executive Officer of Amref Health Africa. And so, Dr. Githinji, as we wrap up, there are many themes that you've highlighted in your discussion. And many of these themes, no doubt, will be expanded upon during the conference. I mean, you've mentioned just now the very important need to redesign our health systems from a curative to a preventative, thereby recognizing the changing burden of diseases we have on the continent beyond just the communicable to the non-communicable that we know, as a matter of fact, are very, very expensive to maintain. And that will really also require redesign on our health financing, as we mentioned. The geopolitics is really, really forcing that discussion. So really, in closing, Dr. Githinji, just your last thoughts. As we look forward to the year ahead and the discussions that will take place at AHAIC, what are your hopes on some of the key themes or key outcomes from this conference and how these discussions can lead to that, sustainable change that we all look for on the African continent?
I look forward to a conversation beyond AHAIC of redesigning our health system and realization that if we do not redesign our health system, it's going to collapse. I see it clearly that in another 20, 30, 40 years, our health systems will collapse. So that is important for us to take this conversation forward. This next conversation I really want us to talk about is this social conversation on the health system. That if Africa doesn't realize that population development is critical to and linked to healthy and prosperous societies, then we have a challenge. In this continent, we have a challenge of ensuring that we manage adolescent health. We have a huge youth population, but in many countries in the continent, up to 1 out of 4 girls between 15 to 19 have been or are pregnant. That means that actually we are facing a crisis but refusing to respond to it. And we are refusing to respond to it because of external factors that we call morality and ethics, and all these things that stop us from actually making people-responsive policies. And if we don't address that challenge of ensuring that we have, comprehensive reproductive health services that address the challenge and allow girls to mature, to delay their first pregnancy, to get full human capital of education and health for them to be able to participate fully in the socio-economic sector, then we have a challenge as a continent, and we will continue to burden our health system with maternal health challenges, morbidity and mortality, and also remove a critical part of our population from the education system and full participation. So these issues are cut across political decision-making, social welfare, and economic development, and eventually impact the health system either negatively or positively, depending on the policy making we do. So these are the themes that I would like to advance forward beyond this AHAIC 2025 in Kigali.
Thank you so much for that, Dr. Githinji. And as I mentioned, we are slowly wrapping up and really looking forward to the discussions that will take place at AHAIC this year. We encourage our listeners to share their thoughts on how health and socioeconomic ecological dynamics are interconnected. And we really want to hear from you on our different social media handles at Nigeria Health Watch and at Amref Health social media handles as well. We want you to also go to the conference website, www.ahaic.org. I'm sure, Dr. Githinji, people can still register, correct?
People can register. We invite everyone, including the private sector, to come and be part of this conversation. And the registration is still open.
Fantastic. So we encourage you all to register for the conference. It's still open, and we look forward to all the discussions that will take place. We thank you so much for your time this morning, Dr. Githinji. And yes, we look forward to seeing you again. Thank you very much on behalf of our team at Nigeria Health Watch. Thank you.
Thank you very much, Vivianne. Thank you.